My name is Judy Foxworth. I'm an associate professor at Winston-Salem State University Physical Therapy Department and one of the directors of the Human Performance and Biodynamics Laboratory. We had a lot of movement equipment that we needed a space for. Wake Forest had the desire and space for us to place a motion lab, and so a marriage was born. It was actually the brainchild of Dr. Teresa Carr.
This is really a very significant project for us. We're very excited. Started as a conversation really 2 years ago between our faculty and the faculty at Wake Forest in 2007. And we began to talk about how we could take our research to a new level, how we could increase access for our students to technology, and have them really learn how to do these advanced techniques that they can use both in the clinic as well as in research if they chose to go further with their education.
We signed an agreement, a memorandum of understanding, and that basically got the ball rolling. A year ago I joined the team and have been helping to establish this laboratory. One of the nice things about our facility is that we have access to patients. It's right here at the medical center, so it's very convenient.
As part of the collaborative agreement, Winston-Salem State University has provided a full-time lab manager.
My name is Ben Long. I'm the laboratory manager at the Human Performance and Biodynamics Lab. I am in charge of basically the day-to-day operations of the lab. Subject recruitment, subject preparation, data analysis, data collection.
It gives the directors of the lab the ability to oversee and plan projects, whereas Ben will be here to actually run the day-to-day operations and to make sure that everything is organized and the equipment works.
Our lab has a 10-camera motion capture system. And what we're actually looking at is the tracking of passive reflective markers that we place on anatomical positions on the subject. So what we're actually seeing is the marker data or the trajectory data. With that information, we're then able to run our calculations and do our prediction equations to calculate joint reaction forces, joint torques, and various other biomechanical variables that are used with our research.
Part of the goal of this laboratory is to progress rehabilitation, to test different techniques, strengthening programs, and we can, in this laboratory, measure the way that people function and move in their environment before and after a specific rehabilitation technique or even surgical technique. And so we expect to add to the body of knowledge of rehabilitation techniques.
One of the great advantages of this laboratory is that it's interdisciplinary.
And we've brought together different expertise from the two institutions, physical therapy and knowledge of biomechanics, along with bioengineering at Wake Forest and medicine.
In addition, with all these different groups, we can take a study that looks at one particular thing and then look at it from a lot of different angles. I'm a biomedical engineer, which is one of the major branches of researchers who work on movement analysis. So I could take a study that maybe Dr. Foxworth is doing and apply a mathematical model to that. And this not only enhances my research, also enhances her research because it's the same data set that we're both studying. We can take all these different technologies and all these different people with these diverse backgrounds and put it all together, and it's all in one laboratory. We see each other every day, and it just works out really well.
This lab is going to be important for our community. What it's going to let us do is do research projects that could address specific needs. We're already planning projects and putting together research grants to address these issues.
It gives our faculty and students a place to come and learn and perform high-level research and incorporate it into our educational programs.
This collaboration will be very useful in getting good access to patients by both the physical therapists and the physicians and the engineering people.
It gives the physicians and the medical students and residents chances to interact with physical therapy students. The result is to better the health of North Carolinians.
And this is going to allow our students to compete with students all across the nation. We've got a lab that's second to none, so our students are going to have expertise that probably not all PT students will have. So we're really preparing them for a doctoral level experience.